Senator, you are in a state that still hasn't expanded Medicaid. Now, as Medicaid unwinds across this country, we've heard reports in Florida and Indiana where people are being thrown off of Medicaid for procedural reasons, meaning that they did something, they wrote something incorrectly on their application. Doesn't mean that they're not, they don't belong on Medicaid,
right?
But they're not giving the opportunity to show that they are. So since you're in a state that doesn't have expanded Medicaid, what are you doing? Are you involved in any of that? What's going on in Wisconsin?
Yeah. Well, first of all, I'll never give up on the fight to try to persuade our state legislature to accept Medicaid expansion. There's just no reason, and obviously it has real impacts on people's health and people's access to healthcare coverage and the provision of healthcare. And so that's a battle that will continue. But secondly, as the public health emergency came to an end, that declaration, that's what you're talking about in terms of people being kicked off Medicaid in many circumstances. I was proud of our work to make sure that children who were under CHIPS or Medicaid had additional time to have us be able to create assistance to get a smooth transition so that children are not left uninsured. And then also in our legislation, the Inflation Reduction Act last year, we were able to keep the pandemic era extra assistance for people to be able to afford their premiums if they get their health care through the Affordable Care Act marketplaces, to keep that extra assistance available for the next 2 years. That makes a key difference in terms of the affordability of health care. And so that hopefully will also ease this transition. But there's no getting around it in states, particularly like Wisconsin, where the state legislature has refused to accept Medicaid, additional Medicaid dollars. There's a lot of people who get left without coverage.
Yeah. Well, I appreciate you doing that, fighting for them.